I decided to do a voiceover to explain this concept map. So the scenario was that patient A was an elderly man with left side facial paralysis, fatigue, weakness, dysphagia, malnutrition, medically non-compliant, and was being discharged on a period diet with a PEG tube. The 5 healthcare professionals that I chose for this concept map included the hospitalist, registered dietitian, speech therapist, pharmacist, and an occupational therapist. Obviously, there would be a lot more involved, including social workers and nurses. So starting off, the patient would be admitted by obviously an admitting physician. Then once admitted, they would be seen by a hospitalist who provides inpatient care. And then this hospitalist would obviously diagnose or review diagnosis. They can prescribe and refer and coordinate care to other healthcare disciplines such as the dietitian. Based on the patient's diagnosis, the left side facial paralysis, dysphagia, and malnutrition. The registered dietitian would collaborate with the doctor as well, obtain patient information, and could do nutrition education, including diet, PEG tube feedings, malnutrition education. Obviously, the registered dietitian would be calculating nutrition needs and TPN nutrition needs as well due to the PEG tube, and collab with the doctor for the formula prescription. The registered dietitian could also recommend or refer the patient to a speech therapist, largely based on the diagnosis of the dysphagia and malnutrition. The speech therapist would observe the patient and do a swallowing chewing test to observe the dysphagia and trouble swallowing. Also taking into consideration the left side facial paralysis, weakness. And the speech therapist collabs with the dietitian to ensure the patient receives the proper care regarding diet, formulas, textures, diet modification, and that the patient is going to receive correct nutrients. Once the patient requires the tube feeding, the dietitian will work with the hospitalist or the physician to come up with the correct nutrient needs and collaborate on which type of formula would be best for this patient, which then the doctor can then call and have the pharmacy fill this formula prescription. In the pharmacy, the pharmacist can fill the prescription, prepare it, and dispense it. Work with the registered dietitian to ensure that the formula is going to provide proper nutrition to this patient for his particular needs. And the pharmacist can also provide some patient education on the formula and any type of drug-med interaction that it could have, if it could have. The occupational therapist is really important. Even though this patient is has a PEG tube, he is on a period diet, which means he's still eating or trying to eat. So the occupational therapist can work with the dietitian and speech therapy to work with the patient to perform daily activity tasks, including eating, whether it be getting the spoon or fork to the mouth, working on weakness, working on chewing, and then working with the speech therapist in collaboration for swallowing, and then of course working with the RD to develop an adaptive eating plan. Overall, RDs function as part of the interprofessional team for anything food and nutrition related. This is especially true for patients on some type of tube feeding, needing some extra nutrients through different types of formulas, needing their nutrition needs calculated specifically, working with patients before and after procedures, referring patients to different specialties like speech therapy, occupational therapy, and collaborating with hospitalists and other type of physicians to make sure that a patient is receiving the correct nutrition for them to be discharged from the hospital and not suffer any malnutrition. RDs work collaboratively with support personnel by making these referrals for patients, by consulting physicians, speech therapists for swallowing tests, occupational therapy for adaptive feeding plans, pharmacy for nutrition, formula prescriptions. The RDs should refer patients to other medical specialties when anything is out of their scope of practice. If this is not food and nutrition related, for example, a RD may educate on tube feedings, formulas, and how this is nutritionally going to benefit the patient. But when it came to cleaning and caring for a tube, especially like a peg tube, they would want to refer the patient to their nurse or doctor. Same thing for like prescriptions and supplements. Registered dietitians could suggest a supplement, but they should always make sure to direct the patient to the physician to make sure there's going to be no interactions with other drugs. Or if a patient asks about a particular prescription medication, the dietitian should then refer them to their doctor or a doctor regarding that matter as well. So if the patient needs further medical evaluation is when they should refer the patient.